Hey everybody, Dr. Nick here, and it would not surprise you or anybody else in the world if somebody were to tell you, hey, my chiropractor, I started going to them and they really helped with my back pain. They really helped with my low back or my neck pain or my muscle tension, right? That would not be a surprise to anybody. But what would be a surprise to most people is if you said to a friend or family member, hey, guess what? I've had migraines for 20 years. I started going to my chiropractor and they're gone, or they're so much better. Or hey, my kid has been struggling with focus in school and having big emotions, and now they're doing so much better. They're excelling. They're actually able to sit and do their homework and focus better in school. Or their nighttime routine has improved. They're not so wound up. They go to bed easier. They sleep through the night. My kids' immune systems have been so much better this flu season. If somebody were to tell you that, you might be thinking, "Wow, what are you talking about? Like how does chiropractic help with those things?" And that's what I want to talk about today. See, as a chiropractor, when I sit down with a parent and I go through their health history and we hear those things, whether it be digestive issues, anxiety, migraines, immune system issues, ear infections, allergies, sinus issues, you name it. Those are what you call a symptom. All right. Now, if you think about what a symptom is really your body's alarm system. The example that I give to patients all the time is if the fire alarm goes off in the building that you're in right now, your house or your work or whatever, the fire company's not going to come in and start tearing the alarms out of the ceiling because the alarm isn't the problem. And I view health and I view symptoms and all these health challenges that we have and that our kids have as not the problem, right? Your kid's inability to focus, your headaches, your trouble sleeping, your anxiety, your digestive issues, those are not the problem. Those are just the alarms going off. Those are the symptoms. So chiropractic care is not designed to treat symptoms, right? If you have allergies, a medication is designed to treat the symptoms associated with allergies. Stop your nose from running, stop you from sneezing, stop your eyes from watering. If you have anxiety, a medication is designed to treat anxiety, to treat the symptoms associated with anxiety. Chiropractic care is different. This is not a treatment for any symptoms. This is not a treatment for any of those things. The way that we approach care is our goal is to find out why. Our goal is to find out where is the fire, where is the smoke coming from that's causing those alarms to go off in the first place, right? And so often we even see a ton of patients come into our office that have been to a chiropractor and they say, yeah, I went in the past and I went whenever I needed it, whenever my neck hurt or whenever my back hurt or whatever, and I got adjusted and it felt better. And then I go about every 4 weeks or once a month, or I go when I need it, or in other words, when the pain comes back. And it's just a big cycle. You're just going through treating the symptoms. You're treating the pain. You're treating the migraine. You're treating the issue, as opposed to getting to the root cause of the problem. Now, as a chiropractor, when we work with the spine, when we work with the back, we're not working with the spine because you have bones back there. We're working with the spine, and we're concerned about the spine because your spine protects your nervous system. Now, if you think about what your nervous system does in your body, what does your nervous system control? I ask this to almost every patient that comes into our office, and we always come to the conclusion that your nervous system controls everything. It controls your muscles. It controls your response to your environment, meaning anxiety, stress hormones, stress. It controls digestion. It controls respiration. It controls your immune system, right? So if there is a problem, if there's an imbalance to your spine, then there's also an imbalance potentially to your nervous system. And that's what we're looking to get at. Because if we find in our office that your nervous system is not functioning properly, then our goal is to improve the function of that nervous system, is to balance the nervous system or remove what we call subluxation. Subluxation is just a general term for stress or an imbalance to the nervous system. So as a chiropractor, when we remove subluxation, we remove stress and tension on the nervous system, then that is going to allow the system that controls everything in your body to start functioning better. So when somebody tells you, hey, yeah, my digestion got better, my allergies got better, my immune system got better, my kid's behavior got better, it's not because we treated their behavior or treated their ADHD or treated their digestive issues. It's because we removed that interference and that stress and tension. We removed subluxation in the nervous system, and their body's able to function like it was designed to. It's kind of like growing a plant. It's kind of like, I think of health in general as like growing a plant. A plant needs three things. It needs good soil, it needs water, and it needs sunlight, right? Now, if you have a plant and it's in the best soil in the world, and you have and it gets the best sunlight that you could ever get for that plant, but it lacks water, it lacks proper hydration, it's not going to grow to its potential, right? And the body is the same way. If you give your body, you know, the right nutrition, right? And maybe we see this a lot. Patients, they change their diet. They've removed gluten. They've removed red dyes and all these different things. They exercise. They meditate. They pray. They do all these things to help their body improve in their health, but they don't have good nerve supply. If they have subluxation, if they have stress, that's like that plant that is missing the water, right? It has everything else it needs. It's just lacking the water. And when you give that plant that's not getting good hydration, water, man, it flourishes. And the body is the same way. If you have tried the essential oils and massage and digestion and exercise, but there's still something that's preventing your body from functioning properly, let's check your nervous system. Let's check for subluxation. Let's see if there is a fire that's preventing that alarm from stopping going off. Right? And that's what we do as neurologically focused chiropractors. So if you're watching this video and you're curious as to if there is something like subluxation or stress and tension in your nervous system that you have not had checked, you have not had corrected, then please give our office a call, send us a message, give us an email, schedule an appointment. We'd love to show you how we can help. So as you go through this holiday, if you're talking to somebody that's interested in chiropractic or they're interested in learning more about how chiropractic works or how we can help this or that, please share this video with them, and we hope that it finds the right person and that it lands them in our office and we're able to help them with neurologically focused chiropractic care. So Merry Christmas to everybody. Have a Happy New Year, and thanks for joining us today.